like to welcome all of our viewers. We thank you, as always, for joining us each month. And I'd also like to welcome our guest. We have Dr. Christina Lippe joining us this morning. She is a partner and shareholder at the Eye Consultants of Pennsylvania, and she specializes in things like cataracts and plastic ocular surgeries. So my name is Mark Levengood. I'm the counselor at the Vision Resource Center of Berks County. And our topic for you today is actually taking a look at thyroid eye disease. So good morning, Dr. Lippe. How are you today?
I'm good. How are you? Thanks for having me.
I'm well, thank you. Thank you so much for joining us and giving us part of your day. We really appreciate it.
No problem.
So if you could just start us off with a big picture, what is thyroid eye disease?
Yeah, so thyroid eye disease is an autoimmune disease that's secondary to thyroid dysfunction that affects the eyes. Basically, what I tell patients is that people who have thyroid eye disease, 90% of them have hyperthyroid or high thyroid or Graves' disease. About 6% have euthyroid or normal thyroid function, and 4% of people have hypothyroidism or low thyroid. Out of the people that have thyroid eye disease, most of them are Graves' disease patients. So about 30% of people who have Graves' disease can develop thyroid eye disease. But thyroid eye disease is still rare. About 19 in 100,000 people are diagnosed each year.
Okay. Now, what causes thyroid eye disease? I know you said it's an autoimmune disease, but what causes it?
Yeah, so we don't understand complete specifics, but what we think happens is that the thyroid is either high, low, or it's abnormal. And what happens is these antibodies are released and they proliferate and they activate some of these cells called orbital fibroblasts. These fibroblasts are in charge of basically making connective tissue in the body. And what happens is when these fibroblasts are activated, they produce some molecules called glucosaminoglycans, which basically are molecules that really swell and attract water. And when that happens, it causes the muscles around our eye and fat around the eye to swell and enlarge. And it causes some of the things that we see on exam on these thyroid eye patients.
Okay. So what are some of the precursors and warning signs of thyroid eye disease that it might be starting to develop?
Yeah, so on clinical exam, what we see for patients that have thyroid eye disease is the most common thing we see is lid retraction. And lid retraction is when kind of the eyelid's kind of more open, so you can see more around the eye and the white part of the eye. That's the most common thing. Other things we see is that we see proptosis, or when the eyes kind of bulge out more, so people kind of have this surprised look. We can see conjunctival injection or redness. We can see the ability to move the eyes around is not full. So there's this restrictive mobility that occurs with patients. You can see swelling of the eyelids, swelling of the conjunctiva. Those are the main things that we see with people who might have thyroid eye disease.
Okay. And Dr. Lippe, could you explain for us the symptoms that a person might experience after the diagnosis of thyroid eye disease?
Yeah, so the number one thing I hear from patients is that they experience this boring orbital pain. So they just kind of feel this congestion and pain. Other patients might complain of gritty sensation or sensitivity to light. Some people have double vision, so they'll notice that. And some people have vision loss, but that's very rare.
Okay. So what is the general field of vision like for someone who is experiencing thyroid eye disease?
So what happens with thyroid eye disease is you can get some optic nerve compression. And this happens because the optic nerve lies within the muscle cone in the eye. So as the muscles proliferate from thyroid eye disease, they get bigger and they kind of then constrict onto the optic nerve and can cause swelling or damage. And when this happens, people can experience a loss of vision, and therefore they can have some loss of their peripheral visual defects. However, it's rare. Less than 5% chance, or less than 5% of people present with this optic nerve compression and vision loss.
Okay. So for those who do, it's they're maintaining the central vision, and the peripheral is what's deteriorating if they notice loss of vision.
Yes, most of the time.
Most of the time, okay. Now, if left untreated, can thyroid eye disease lead to total blindness?
If completely left untreated, it is a very severe case. Yes, technically, but
Mhm.
like I said, very rare, and I can't say I've seen a case like that.
Okay, so just not uncommon. It just okay.
Mhm.
So, Dr. Libby, could you explain for us how someone's thyroid is connected to their eyes and thus their vision? I mean, if I'm aware of the anatomy right, our thyroid is like kind of in our throat. So
Yeah,
how does that connect to our eyes?
it's a great question. So yes, like we've talked about, the thyroid dysfunction occurs, and we don't know why. You could be high, you can be low, you can have Graves' disease, you can have Hashimoto's disease. Um, and basically, when that thyroid becomes unregulated,
Mhm,
it just overstimulates the body. And when that happens, like we talked about, those fibroblasts get activated and it causes that proliferation of the muscles and the fat. And
mhm,
people experience, those sensations of, gritty feeling, maybe blurry vision, double vision.
mhm.
So it's basically the hormones, because the thyroid does a lot in our body, it controls a lot of
Right.
things in the body.
Okay.
And it can attack the eyes.
Okay. Now, Dr. Lippy, you've mentioned Graves' disease several times. What is Graves' disease, and how is it connected to thyroid eye disease exactly? I think you said earlier, I think you said 30% of people with Graves' disease end up with thyroid eye disease. So, like, what is it? What's the connection?
Yeah, so Graves' disease is an autoimmune disease as well. And basically, the body produces these autoantibodies that then attack the thyroid stimulating receptor on the thyroid, and then it produces all this thyroid hormones are released.
Okay. Okay. And earlier you also mentioned underactive and overactive thyroid function and how that can lead to thyroid eye disease. It sounded like you said overactive is more common, leading to thyroid eye disease than underactive.
Yeah, so when I see people with thyroid eye disease, like I said, 90% of them, yeah, have Graves' disease.
Okay.
And actually, it's interesting to me that you can even have it in normal thyroid function. It's rare,
Uh-huh.
6%. But I have to admit, I saw a woman in my clinic. She had just eyelid retraction on one lid, and there's really only one thing that causes that. And she said, "You're one of those people with normal thyroid and have some thyroid eye disease findings."
Okay. Interesting. Now, is thyroid eye disease found in any specific age bracket, or can people be diagnosed with it at any age, from childhood on up through seniors?
Yeah, so the age range really is from 8 years old to like 88 years old, but really you
Okay.
usually see it in like mid 40s, mid 60s.
Okay.
It is more common in women, and it is more common in smokers. So
Oh.
anyone that smokes, highly, highly recommend to stop smoking,
Mhm.
because they not only have worse thyroid eye disease than the average person, but it also lasts longer and have higher risks of reactivation.
Okay. Now, is thyroid eye disease pretty much a standalone eye condition, or is it connected to things like glaucoma, macular degeneration, etc.?
It's mostly a standalone condition. It is tied in very closely with dry eye disease. And that's it really because, the people have more proptosis and lid retraction. So the eye's more exposed. So
Mhm,
the eye dries out faster. And that's why people have a lot of that gritty sensation, photosensitivity is because they're dry. So
mhm.
I'd say that's like the number one. About 1% of people that have thyroid eye disease can also have myasthenia gravis, which is a separate autoimmune disease. But
Okay.
overall, it's kind of standalone, and really, if people experience any other eye disease with it, it's dry eye.
Okay. Now, if someone has thyroid eye disease and then down the road they are diagnosed with something totally separate, since thyroid eye disease seems to be standalone, if down the road they get cataracts, glaucoma, macular degeneration, whatever. How does that further compound and complicate the situation? Does the thyroid eye disease impact treatment of those other conditions, or like how do they all play together?
Overall, really not. You might worry if somebody was on steroids for thyroid eye disease for a
Uh-huh.
long time, which is rare, but you worry about them maybe developing glaucoma. People who have thyroid disease can still have cataract surgery, no problem. So overall, it actually doesn't complicate too much.
Hmm.
Um, the biggest thing too is, double vision as well. So
Okay.
doesn't necessarily complicate cataract surgery or anything, but if somebody might be want to not wear glasses after cataract surgery with thyroid disease, if they have double vision, they might not be able to because they might need prism in their glasses to
Mhm.
treat that double vision.
Okay. Okay. Now, maybe you addressed this, and in my ignorance, I missed it. But could you explain for us what the disease process of thyroid eye disease?
Yeah, so it all comes down to those orbital fibroblasts. So they just become activated and they make those glucosaminoglycans, which then causes the muscles and fat to swell. And when those muscles and fat swell, that's when it occurs. I tell patients there's three things we're really worried about with thyroid eye disease. Number one is the optic nerve compression, because that lies within the muscle cone, and the muscles get fat, push on the optic nerve. The
Right.
second thing it causes double vision, because what happens is the muscles become thicker and fatter and then are restricted. And it usually affects the inferior rectus first, which is the lower muscle, and then it does the medial next. And basically, people will notice that if they like look up, they'll feel like a muscle get like kind of tight, and then they might get
Mhm.
double vision looking up. Or if they look to one side or the other, they might have double vision from that. And then the
Okay.
third thing is with the dry eye, because the lids become retracted, the eyes become more open, and that causes the dry eye. Now, there is also one receptor that I didn't discuss yet that is affected by thyroid disease as well. It's the insulin like growth factor receptor.
Mhm.
And that one also can become stimulated by the thyroid hormones. And then that can also cause the fibroblast to proliferate. And I bring that up because there is a new treatment out that attacks that receptor, which we can talk about soon.
Okay. Now, is thyroid eye disease a new discovery or diagnosis?
It is not, but it's on people's radar more now because of these commercials. I don't know if
Right.
you've seen or heard of them. It's the Tepezza commercials.
Yeah, there's all kinds of commercials on TV and radio in recent years about thyroid eye disease. So if it's not new, what's with all the commercials?
Yeah, so it's because there's this new treatment out. It's called Tepezza or teprotumumab,
Hmm.
um, which is a monoclonal antibody that attacks the insulin-like growth factor receptor.
Hmm.
And what it does is it blocks it so the thyroid hormones are not don't stimulate it. And by
Hmm.
doing that, it causes a decrease in the activation of those or orbital fibroblasts and therefore less swelling of the fat in the muscles around the eye.
Okay. So is that for prevention or more for slowing the progression of thyroid eye disease?
It's a great question. So it's actually the first medicine out that actually reverses it. It prevents it from worsening and it actually reverses it. So studies have shown when they first released this medication, which actually was released in 2020, the studies show that about 90% of the people in the study, their amount that their eyes kind of bulge open, the proptosis, decreased by 2 or more millimeters. So
Okay.
people have less of that surprise look and they look more like they did before they were diagnosed with thyroid eye disease, which a
Hmm.
lot of people love because that's a big thing for a lot of patients. They look completely different than they did years ago.
Right.
And until we had Tepezza, there really wasn't a great option other than surgery
Hmm.
to decrease that proptosis for patients.
Hmm. Is there any form of treatment at this point that can cure thyroid eye disease? And, I know you said it takes away the eye bulging, but if there had been any vision loss that on the periphery that could be restored?
So there's nothing that takes it completely away. Tepezza is the closest thing we have to reducing the severity of thyroid eye
Hmm.
disease. You know, in the past, if somebody had really bad orbital optic nerve compression, you would do something called a surgery called an orbital decompression, where basically what happens is they would remove some of the bones around the eye and basically gives the eye more room to expand.
Okay.
And by doing that, then the proptosis gets better, and then the optic nerve compression gets better because you give more room for those muscles and fat to expand, so they're not pushing on the optic nerve. But fortunately, since Tepezza has come out, people are doing less surgery for that because you can, if people are candidates for Tepezza, they use that, and it helps to reduce the proptosis without that major surgery.
Hmm. So prior to Tepezza, was the surgery really the only option, or were there other forms of treatment that, progressed through the years since it's not a new diagnosis or discovery?
Yeah, so when it comes to treating thyroid disease, the biggest thing is treating the thyroid. By
Okay.
helping to treat the thyroid eye disease, you treat the thyroid, and that helps prevent it from worsening.
Hmm.
Because mostly with thyroid eye disease, what happens is people might have like an active phase where it gets worse over about a year, but then it kind of peters out and regresses a little bit. So the biggest thing is you want to try to control the thyroid function to make it normal so that your risk of having thyroid eye disease decreases.
Okay.
After that, options are if you have somebody with really bad proptosis and with the optic nerve compression, they would do some high dose steroids,
Hmm.
and which, as we know, a bunch of high dose steroids really isn't great for the body, especially if you're diabetic, high blood pressure.
Hmm.
Long term use can cause glaucoma. So they would kind of do that as like a band aid to see if that would help get that inflammation around the eyes, the fat to decrease and decrease that optic nerve compression. So
Hmm.
that's what like most people did. You usually would do like an IV steroid treatment and then
Okay.
maybe need to do a surgery. There is some people used to do orbital radiation. So they would do radiation to the muscles around the eye. And the thought is by doing the radiation, it kind of kills off those inflammatory orbital blasts and T cells, fibroblasts and T cells. So then the thyroid eye disease almost kind of freezes. It doesn't really regress it, but it makes it prevents it from worsening. But
Okay.
less people do that less now as well.
Right. Yeah, you mentioned the surgery to remove orbital bones so that the eye has more room to expand. I, I can't imagine that. Like, that seems so invasive and
It's
intense.
It is a big surgery. It is a big surgery. We used to do them in residency. It's usually not a surgery you can do by yourself. You
Sure.
usually need to have like an assistant. Yeah, and it's very involved. And usually, depending on how the person's thyroid eye disease looks, they would decide what wall to remove because you can remove the lateral, inferior, or medial. And depending on like what the muscles look like and what the patient needed, you might just remove two walls or one wall.
Right.
Um, and yeah, it was a very involved in surgery. And the other thing is too, is when they did the surgery, afterwards, you know, they're not as proptotic, but then they can develop strabismus. They can, then develop the double vision. So then they need eye muscle surgery. And then after the eye muscle surgery, anytime, sometimes you move some of the muscles, depending what muscles move, you can affect the lids, or the lids are affected, period, just because of the thyroid, they're retracted. So then they might need a lid surgery. So it
Right.
ends up most people, if they had an orbital decompression, might not stop at just at one orbital decompression. They might
It's
then
like
need strabismus surgery or a lid surgery.
it's like dominoes. It's
Yeah,
like you start with the orbital bone removal, and it just goes from there because of the side effects, so to speak.
exactly. All the
Wow.
muscles and anatomy of the eye all connected together. You move one
Hmm.
thing, it might affect another.
Okay. So, Dr. Lippe, as we begin to close, just a couple quick questions for you. What can people do to be proactive against developing thyroid eye disease? Is there anything?
Well, so the biggest thing is, see your routine primary care doctor for
Mhm.
your annual exams. Usually they will check your thyroid function. And, if you do find that your thyroid function is abnormal, work with them to treat it. is the
Okay.
biggest thing. You want to get
Yeah.
your thyroid levels under control and treated.
Hmm.
Um, and then from there, if you end up having thyroid that's irregular and need treatment, lately I've been seeing a lot of referrals for people that just want to check to see if they have thyroid disease. So their endocrinologist will send it to the ophthalmologist and look. Unfortunately, most of the time, the patients I see really just have a little bit of dry eye, which
Hmm.
we just treat with over-the-counter lubricants, or you can do like a little punctal plugs that help, or medications for dry eye. So that's like the biggest thing I see, fortunately.
Hmm.
But the biggest thing is those annual checks with your doctor, see if you have any irregularities with your thyroid. And like we
Sure.
talked about, thyroid eye disease is rare. Just because you have thyroid disease doesn't mean you're going to get thyroid eye disease. So I don't
Right.
want people to stress out about that.
That is encouraging. But just in case people would want to learn more, where would you recommend they go to learn more about thyroid eye disease?
Yeah, so I'll be honest with you. I had to look this up. I know you can find things on our Academy website, the American Academy of Ophthalmology. I believe also there's like a thyroid association you can look up. And then there are websites like Penn Medicine or Cleveland Clinic have just some information on explaining thyroid eye disease.
Hmm. Right. Excellent. Well, Dr. Lippe, thank you so much for giving us part of your day and for joining us to help educate us on this important topic. As we said earlier, while it's not a new diagnosis or discovery, it's suddenly on the radar of the general public just within the last 5 years or so. And thanks to you, now we know a whole lot more about it. So thank you so much for informing us and giving us part of your time.
Hey, thank you for having me. It was a pleasure.
Of course. And to our viewers, thank you again for joining us. We hope you enjoyed the program, and hopefully this shed some light on those commercials that are so widespread anymore on TV and radio regarding Tepezza and thyroid eye disease.